Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Leslie Krigstein, Vice President of Congressional Affairs at the College of Healthcare Information Management Executives, CHIME, where she oversees CHIME's congressional advocacy engagement efforts, which are focused on the effective use of information management within healthcare. Prior to joining CHIME, she was a member of the Congressional Affairs team at HIMSS. Welcome, Leslie, and thanks for joining us.
Thanks, David. Great to be here.
So over the years, one of the bugaboos of health information exchange has been the difficulty that we all have with patient matching. Some have pointed a finger at the federal budget legislation that each year at least used to bar use of funds for development of a universal patient identifier. I'm interested in hearing what do you see as a way forward on this front? Do we need unique identifiers in order to achieve patient matching at an acceptable accuracy level, or are there other approaches? I know CHIME was involved at some point with a challenge around patient matching, and then that sort of evolved into something else. And maybe you could speak to the innovation task force that has followed on to that challenge. And generally, from your perspective, how are we doing on this front? Where are we on patient matching?
We, in some sense, have come a long way, David, and in other sense, we have quite a long way to go. Putting my policy hat on, just in the last few years, relative to the federal budget ban, the perpetual hamstrung nature of being able to spend any federal funding on the promulgation of standard for a unique patient identifier has certainly initially hindered a lot of conversation on this issue. And it's more recent, I would say, in the last few years, there's been a renewal of dialogue and willingness of healthcare players across the spectrum to re-engage. And so we've been relieved and happy in a sense of the fact that the last fiscal year, and hopefully with the passage of the funding bills for this year, we'll see the continued okay, so to speak, of Congress saying, sure, CMS, ONC work with the private sector to evaluate best practices and opportunities, but we're not yet allowing any federal funds being used for a unique patient identifier. So I think we've seen progress there. And I think, the fact that there is able to be a much broader dialogue, I think has moved this conversation forward. It's been a top issue for CIOs for as long as I've been at CHIME, and even prior to that. It's really hard to have a conversation about interoperability and not have the ability to accurately identify a patient come into the mix. So we did set up a $1 million challenge, and for a number of reasons, including the fact that there is so much evolution in the technology in the time that we first put the challenge guidelines together, and now we took a step back working through this innovation task force, which is still in its infancy, to put some thoughts together and figure out how, with an industry-led approach, we can leverage the different technologies that are at play and see really if there is that opportunity to pursue something at least harmoniously across the ecosystem that may alleviate the need for a UPI or at least a government mandate. But I think there also is renewed conversation at ONC with CMS that we may even see some action on that side as well. So, it's a number of factors coming together. I think the more that we've reduced some of the stigma that had clouded this issue for the first decade of the conversation, I think we have seen a lot of progress. And I think technology has been a great asset in that, because it's come in so many forms, and that we've had a lot more competition in this space. And hopefully, if we're not able to get to that point of having some kind of government mandate, there will at least be a number of technology alternatives to hopefully make patients feel secure and confident in the value of this sort of technology, but also to really get to that place of interoperable healthcare, which I think we would agree is more of a dream than a reality today.
Right. We're not quite there yet. So it sounds like you're saying that there's the benefit to having a government more hands-off approach for now, but possibly a mandate in the future in this area.
Yeah, I absolutely would say that the government absolutely needs to be at the table. And the fact that we've seen the change in the Appropriations Committee report language, at least over the last 2 years, is significant. The fact that Congress is no longer kind of hiding behind that language from 1999, given that, many things have changed. You never, especially in this administration, I wouldn't expect them to take a mandate or heavy-handed regulatory approach. I think we will see if a more hands-off, more market-driven approach will be more beneficial to getting us to the ideal state where we'd all like to be.
So I certainly hope that we can collectively make some progress there. It seems like we have made progress, and some of the patient matching tools are getting better at doing what they need to do and combining duplicate entries for individual patients and so forth. Another area that I understand is a priority for CHIME in this year is related to the opioid epidemic. And this, of course, is a national healthcare crisis. And I'd like to understand better the nature of the organization's involvement in this issue and what you have been working on. How are you approaching this issue?
The opioid epidemic is something that CHIME has really taken a hold of this year. We launched at the tail end of last year an opioids task force. So Congress has been very active. We've seen, of course, the federal government very active. And it seems that within healthcare, we're seeing a lot of different initiatives pop up, and CHIME recognized that there are a lot of opportunities to be leveraging best practices to share across our membership, but also look for policy ramifications or hurdles that we may be able to bypass if we come together as a community and leverage our relationships both within the CHIME community and across healthcare broadly. So we formed this task force in honor of one of our members lost his son to the epidemic late last year. And so he's the co-chair along with one of our other long-term CHIME members. And our task force is a combination of CIOs, of members of the CHIME Foundation, so technology vendors, service providers, consulting organizations. And we are in the midst of putting together a best practices playbook that we'll be sharing, as well as doing some education opportunities. And then I come and step into the mix. And we're also, like I said, looking at some of the policy barriers that we see in terms of the IT space that could better enable our clinicians to take care of these patients. And so whether it's looking at shortcomings of HIPAA or looking at favorable policies to try to get PDMPs to be integrated into the EHR more seamlessly, we know technology can be a great asset. It's just a matter of kind of getting the policy out of the way to allow that to happen. So
the work that I've done in this area has often revolved around the conflicts between HIPAA and 42 CFR Part 2, crossing that line into substance abuse treatment. And I'm wondering if that's an area that you've encountered as well.
It is. And there are some bills on Capitol Hill that have been considered on this topic. CHIME did endorse a partisan bill that was included in H.R. 6, which was the large opioids package that passed the House earlier this summer. But that's something that we've heard from our members. And for better or worse, there's an acknowledgement of we all can say HIPAA's created in an era that the current state of technology doesn't necessarily jive with. And this is one of the issues. And so we actually, supported the bill, endorsed the bill, and recognize that this information is of the utmost sensitivity in many cases. And we just need to make sure that we are respecting patient privacy, but at the same time, enabling the sharing of this information that's absolutely critical to patient safety. So that is one of the major areas that we've engaged on thus far on the policy work of our task force.
Do you see in this arena sharing of best practices across individual states and individual provider organizations and, coming from your CIO members and seeing what can be shared? Is that the nature of at least some of the work that's being done now in order to develop a more cohesive position?
Some of it, yes. A lot of our members who are hospitals or clinics in different states have been a great asset to us. And also those who have had, because of variance in state laws, the more strict versus the more lenient, have all been able to come to the table to share how they've worked within the boundaries that are applicable to them. But one of the longtime things that we've asked, even prior to engaging on the opioids topic is there's a lot of headache when it comes to making sure that state to state versus national, if you have or you're treating patients in different states, having a robust national dialogue is something that on the CHIME wish list has been there for a very long time. And I think it's kind of come back to prominence with this opioids topic. So hopefully we'll have, something we can share fairly soon on our best practices and on our playbook as it relates to this topic and some of the more kind of IT technical, tactical recommendations that CIOs could employ within their health systems.
Great. I'm sure we all look forward to seeing that. If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Leslie Krigstein from CHIME. Leslie, in health IT generally, we are faced with the twin issues of security and interoperability, making data more readily accessible across systems and across organizations naturally increases the potential exposure to security exploits. Do you see these two imperatives as two sides of the same coin? And I'm wondering if you have some good news for us on the security front or on the interoperability front.
Oh boy, I'm not sure about good news in either fashion. We had some folks out at one of the big security conferences that's happened recently, and there was a lot of concern about healthcare continuing to be a major target for these bad actors. So I wish I had good news, but I think, we've all had a pretty harsh dose of reality as it relates to this space. And whether it's looking at the integration of IoT into healthcare or as we move to interoperability and really incent the sharing of information. Because I feel like with the early days of meaningful use and now promoting interoperability, there was so much conversation about adoption. And beyond the security risk analysis, we really didn't do much by way of thinking about security and this next frontier. So we're a little behind the eight ball. And, when we talk to our members, it is cybersecurity is, issue number one. And interoperability is generally issue number two. So we are well aware of the complexity of the relationship. But, I think there has been on the policy side a recognition by HHS that they need to take a more prominent role on healthcare cybersecurity. We've seen Congress be more engaged on healthcare cybersecurity, especially as some of the larger scale breaches or incidents like WannaCry and NotPetya from last spring. But there's still so much more to be done. We had the Healthcare Industry Cybersecurity Task Force report that came out last June that really laid out a lot of opportunities for improvement in that space and acknowledged the fact that we really are trying at the same time to, open the doors and windows to share the information, but then batten down the hatches to keep the bad guys out. And those bad guys need to find one vulnerability and we've got to patch, every hole. So, not sure about good news, but it's definitely an area of growth and an area of opportunity for our members. We are looking to whether it's the Trusted Exchange Framework and Common Agreement that's forthcoming from ONC or on Capitol Hill, the Pandemic and All Hazards Preparedness Act. They're going to include some cybersecurity directives in that would elevate HHS and their ability to assist the industry. So, the fact that, again, it's something that's coming out of the shadows and is really at some points kind of almost smacking us in the face with how large some of these breaches have been to organizations, both of great security, maturity and those who are fairly nascent in their security postures. It really shows that you're only as strong as your weakest link, and they're looking for any opportunity. So it's real. It's a little scary, looking at these different monitors that are hooked up to bedsides, hoping that they're secure because, seeing them as a potential entry point for a bad actor and whether that's using that to enter into the, network is one thing, or, as we saw at some of these security conferences, or manipulating dosages. So, we have a lot of work to do in this space, David.
Yes, yes. Well, you didn't make me feel better.
No.
On the interoperability
Sorry
front, you mentioned TEFCA, and I'm wondering if you could have more to say about that. Have you been involved in that dialogue, and do you see TEFCA as yielding something that will be complementary to or different from some of the announcements that we've heard recently from industry around interoperability via FHIR? I mean, I guess I'm asking, are government and private sector working on two separate tracks, or are we working along the same track here?
I hope TEFCA is able to pan out in the way that Congress, when they passed the 21st Century Cares Act, it meets what their expectations were. Because, I think this notion of a network of networks is, definitely admirable. And we're seeing, so many HIEs or RIOs pop up, across the country with different levels of maturity and different service offerings, that there is the opportunity to kind of bring that under, one hat, so to speak, relative to TEFCA. I think it's going to be interesting to watch what's expected to come out. It sounds like if Dr. Rucker at the annual meeting recently or ONC's Interoperability Summit, mentioned that this is forthcoming, and I think we heard it's a very large rule that may now also include some of the information blocking provisions. So, I think the landscape could change fairly dramatically depending on what is included in TEFCA. And also, I think the industry could get a fairly big wake-up call depending on how information blocking is both defined and what is carved out of. In the interoperability space, I think there could be a lot of change, later this fall and into the early winter months. And how that jives with what we're seeing in the private sector and the use of FHIR. The fact that we saw so many changes in, what is now known as promoting interoperability and the drive to look at open APIs and potentially naming FHIR as the standard, I think they ultimately will come together. But kind of on the practical side, I think our members would tell you that it's not a reality yet in terms of widespread adoption and use. So hopefully it will all come together nicely with the changes to promoting interoperability and TEFCA and the work in the private sector. I mean, even recently, these conversations are happening relative to Blue Button, which is great. I think it's going to be an exciting time. I was a little downtrodden earlier in terms of saying interoperability and security are the best news is yet to come. But, I think they're on the interoperability side. There at least will be a lot of developments, and hopefully they'll be, positive and by means of moving us further down the road in a way that we haven't been able to do to date. So at least, if nothing else, will give us a lot of rules and regs to read this fall.
Oh, yeah, I was worried. I didn't have enough rules and regs to read.
Right.
Yeah. So I guess going further into the private sector, some recent announcements from what I would call infrastructure companies endorsing FHIR and interoperability. And my first reaction to that was more or less, gee, that's nice that they support this, but how does this relate to them directly? No matter what, they need to supply the tools that their customers demand. And if their healthcare customers demand support of FHIR, then they'll have to deliver that. But beyond that, do you see a reason or a connection between your constituencies and these internet infrastructure companies around some of these standards, including FHIR?
The CIO's battle cry is standards. I feel like you can't talk to a CIO who's not going to tell you that
Right.
without a agreed upon standard for basically anything in which they're going to need to have within their digital infrastructure. That's pretty much issue number one. So, I think if we are able to coalesce around a mature standard, and again, allow it to be matured and tested properly, which was some of the criticism of some of the earlier efforts to facilitate exchange, was some of those standards may not have been as mature as others. I'm hopeful, and I know some of our members are definitely leveraging FHIR today, but probably not as robustly across our broader membership as will be necessary if, in fact, we are going down this road. So, it definitely will be incumbent on our members to demand what they need in terms of being able to facilitate the kind of exchange that is envisioned by 21st Century Cures and TEFCA and ONC. But, it will, I think it's in the early days, David, I would say, to see how when push comes to shove, this will actually happen.
Yes, I would agree. And I guess that the first round of all of this will be handled by your members, vendors, rather than by the members themselves, in
Correct.
terms of the common well and care quality efforts and other things like that. So
that's right.
There are many changes afoot, and I guess we don't really know where things will end up. It'll be very interesting to see what happens as a result of some of the current legislative and regulatory changes that are in process. And it's also interesting to see how CMS has been making some pronouncements about being more regulatory in this arena and sort of demanding greater access to information or interoperability of information. We'll see how that changes over time as well.
The inclusion of the conditions of participation especially will be something that's very interesting to watch if that comes to fruition as well.
Yes, that was quite a dramatic proposal, or I guess at this point it's just a request for information, but we'll see what happens. And the follow-up rule, CMS seemed to be saying there will be more to come on that front.
That's right.
I understand that you're convening an advocacy summit. In addition to some of the issues that we've already discussed, what do you see as the key issues that the health IT community needs to focus on in its advocacy efforts? And here I see advocacy on its own behalf or on behalf of its customer community and also on behalf of the ultimate stakeholders who I see as patients.
David, we're excited. This is our inaugural advocacy summit that we'll be hosting here in Washington, D.C. this fall. And there is such a great role for technology in the transformation of healthcare that we see this as the time to really motivate CIOs and those of us in the health information technology community to be our own best advocates. So in addition to discussing, patient matching and interoperability and some of the pending rulemaking, as well as the nation's grappling with the opioid crisis and the opportunity for technology to make a difference there. We're also looking at topics like telemedicine, making sure that we are engaging patients in all communities, looking at those in underserved areas, and also trying to encourage our members to be proactive in the policy conversation, making sure that we are able to, toot our own horn a bit in the CIO community and in the health IT community about just what great work is going on and how we can work more collaboratively with our policymakers within the administration and on Capitol Hill to make sure that technology is able to be as great an asset as possible for the benefit of patients nationwide.
Well, it's certainly a worthy goal, and there's certainly much work to be done in that department. So, Leslie, if you were to wake up tomorrow and find yourself 5 years in the future, is there one thing in healthcare that you would hope or expect would have changed dramatically?
David, I think looking into the future, I was, a big Debbie Downer during our conversation about cybersecurity and interoperability. And those are the two things that in 5 years, I think, will be in a different place. I think we will probably have unfortunately had some major wake-up calls on the security front, but that will stimulate hopefully proper incentives and support that may even warrant federal support for the industry. will definitely, generate a need for education and investment. So I think we'll see some fairly radical changes on that front, and as well as interoperability. We've talked about the fact that there are some policy changes afoot. I think just in my personal experience as a caregiver, as a mother of a patient child with pediatric cancer, interoperability has never been more of an issue for the industry, I think, for patients, but is also an issue for payers. And we're seeing policymakers and we're seeing CMS take a much more active role on the topic. So I think we will be in a much different spot. I think we will see new and great opportunities for patients to be at the center of clinical decision making and their information, which I think will be vital to move us forward. So I think there's great hope on, two things that I would say are not at their best today, but we will, see great progress in the next, hopefully in the next 2 years.
Well, thank you. Leslie, it's been a pleasure to speak with you today, and I thank you for joining me here.
Thank you, David. It was a pleasure.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.